Hello, my fellow YouTubers. This is Karen, 63 in VSG. I wanted to go off topic a little bit today. I wanted to tell you my cancer story and whether or not you think it was divine intervention or just a coincidence. This story starts back, even though I was diagnosed in 2009, this story starts back in 2005. I was in the hospice room with my mother. It was March 15th, the Ides of March. And each of her 4 children, me being the oldest, we had a chance to speak to her privately on that day. And she was lying in that hospice bed, and a small tear trickled down the side of her face. And she said, "Karen, I'm going to miss everybody so much. That's the worst part. I'm not afraid to die. I believe in God. I think I've led a good life. I think I'll go to the right place. But I'm going to miss everybody so much. And who's going to put Dad's socks on?" And I said, "Ma, who's going to put Dad's socks on?" You see, my father, who lives with us now, he has a lot of arthritis in his ankles and his knees, and he has trouble putting his socks on. So it's hard when he goes to church on Sunday, when he has to wear socks, to put them on by himself. And I said, "Ma, don't worry about that. Don't worry about that. I will take care of Dad, I promise you." She said, "Yeah, but I'm still going to miss everybody so much." She was such a family-oriented person. She was the glue that kept our family together. She loved, she just loved. She just unconditionally. She always saw the good in everybody, and she was just such a wonderful, life-loving person. I said, "Mom, don't worry about that." And all of a sudden, this lyric popped into my head, whether it was a lyric from a song or a poem that I had read. I remember, and I said to her, "Mom, there are no clocks in heaven. Time means nothing up there. It only means something down here on earth. You're going to get up there and you're going to think that maybe 5 or 10 minutes passed. And all of a sudden, you're going to see us all there. To us down on earth, it might be we have to wait maybe 5, 10, 20, 30 years to see you again. But to you, it's going to seem like 5 minutes." And that brought a lot of comfort to her that day on March 15th, 2005. She took that and she had a smile. That was the last full day that she was alive. Early in the morning, on March 16th, 2005, my mother passed away. Well, now we fast forward to 2009. I had vowed I was going to work at Moffitt Cancer Center because I didn't live far from Moffitt Cancer Center in Florida, and I wanted to work at a cancer center after my mother passed away. I finally got the opportunity in 2008. In September, I was hired, and I wasn't only hired there to do MRIs. That was my job at the time, but I was put in the Women's Breast Center, and I was doing breast MRIs on all of the newly diagnosed breast cancer ladies, and helping with the radiologists do breast biopsies under MRI. So I just was put in the right spot, and I swear it was my mother, whatever she did up there to put it in the mind of the hiring person. This was the place I was supposed to be at, and I fit in like a glove. It seemed like it was my destiny. That was my dream job. 6 months later, I discovered I had breast cancer. So here I am working at Moffitt, late January. Now, mind you, I had had the BRCA testing because there was such a strong family history of breast cancer. Not only had my mother passed away at age barely turned 70, she was only 1 month into her 70th year, but her sister 20 years earlier had passed away at age 59 of breast cancer. So I had the BRCA testing. Of course, it was negative, but, I had it anyway. And I was considered a high-risk breast patient. So I was in the high-risk breast program at Moffitt Cancer Center. And, I had just had my yearly mammogram, which they always gave me an ultrasound afterwards because I was in a high-risk program there. I had just had a mammogram a couple of months before. I said one day to my radiologist boss, I said to him, his name was Dr. Beecham. He has since passed away, God rest his soul. He was a wonderful, kind, and gentle man. I said, Dr. Beecham, do you think I should get on this MRI table and have an MRI on myself? I said, it's such a detailed exam. I mean, maybe, we would see something that maybe the mammogram doesn't pick up. He said to me, Karen, with your family history and the fact that you've had a previous biopsy before, fortunately it turned out to be not a cancer at that time, but if you were my wife, I would definitely have you have an MRI. So I thought about it, and I thought about it, and then I heard my mother's voice. Karen, listen to your heart. Don't be afraid. I'm here with you. Don't be afraid. I'm here with you. Can't explain it. Maybe it was I was just thinking out loud. I don't know, but it was so clear to me. Don't be afraid, Karen. Listen to your heart. So I had an MRI. Well, the MRI results came back, and of course I could tell exactly what the report said because that was my field of expertise. And as soon as I read the impression down at the bottom where it said I had a BI-RADS4 and the kinetics represented not a good uptake of the, dye that was put in, and the lesion soaked it in like a sponge and then pushed it out. And well, that's all mumbo jumbo to you people, so I won't get into detail. But I knew when it said BI-RADS4 because that's one of the designations that they give MRI breasts according to how severe they think it is. 0 being the least, and I think it goes up to 6, and mine was a 4. So I knew I should go have a biopsy. So I went to a doctor at Moffitt, and I asked her. She said to me, Karen, you had a previous biopsy, so you must have scar tissue in there. These MRIs are so sensitive that they pick up everything, and you don't want to have an unnecessary invasive biopsy, do you? I thought about it, and I thought about it. And then again, I heard my mother's voice. Karen, don't be afraid. Listen to your heart. Don't be afraid. I'm here with you. So I went and had a second opinion. I went to another doctor at Moffitt. And she told me, Karen, if you want to have a biopsy, have a biopsy. I won't say one way or the other, whether you should or you shouldn't, but if you're the boss, it's your body, have the biopsy. Well, around the 1st of February, I had the biopsy under ultrasound guidance, not MRI, at Moffitt. And Moffitt is a designated cancer institute. It's one of the best in the country. It's right up there with Sloan Kettering and MD Anderson and all of those places. It's strictly a hospital to treat cancer. So I was really lucky to not only work there, but to be a patient there. And about a week later, I was coming to work one day, and I was walking down the hallway, and I met up with a nurse friend of mine who was in the high-risk breast program, so I knew her well. And she had gotten the results too, and of the biopsy, and I could tell by the look on her face it wasn't going to be good. She was so pained to tell me because we were friends. She just didn't know how to, and I knew. I said it was positive, wasn't it? I have breast cancer, and she said, I'm afraid so, Karen. Well, that started the ball rolling. All these other tests followed. Bone scan, CAT scans of your chest, your abdomen, your pelvis, blood work after blood work, MRI. Then I was scheduled for surgery. So, again in March, but not the Ides of March, thank God. On March 10th, 2009, There goes my cat. Hello. 2009 March, I had my mastectomy. Now, I said to my surgeon, I want to have a mastectomy. Because as far as they could tell on the MRI and all that stuff, the lymph nodes did not look enlarged. They didn't look like they had any kind of involvement. And the lesion itself was not even 2 centimeters, which is a fairly small lesion. She said to me, Karen, you don't need to have a mastectomy. You can have a lumpectomy. I said, I know, doctor, but I want a mastectomy because the mammogram didn't pick up this cancer. The ultrasound didn't pick up this cancer. Only the MRI that I had picked up the cancer. So she said, okay. And she performed a mastectomy. And both, when we went into it, I remember my mother saying, Karen, I'm here. Don't be afraid. Don't be afraid. I had this little crystal rock that I used to carry around and hold in my hand. It had an angel inside it. And that angel, that was the symbol for my mother. And I would clutch it so tight. And she said in my head, don't be afraid, Karen. Don't be afraid. Well, on March 10th, I had my mastectomy. And when I woke up in recovery, my doctor was right there with this, again, pained look on her face. After all, we were co-workers. And she said, well, I don't have very good news. I said, oh, what? She said, well, the surgery went very well. And when we took out the lymph nodes, I didn't think there was anything. They weren't enlarged. They were a little rubbery, but, nothing to the naked eye that I could see. So we sent them down to pathology. And when we went to pathology, the pathologists cut them open and looked at them under the microscope. And one of them had microscopic cancer cells in them. The other one had a lot of, cancer cells in them. She said, so at that point during the surgery, I said, well, let's take out 18 lymph nodes from the armpit and make sure that we got all of the lymph node involvement. And out of those 18 lymph nodes, it turned out eventually that 4 of them were positive. So as it turned out, I had what was called stage 3A breast cancer because I had 5 positive lymph nodes. Now this is back in 2009, that's how they designated the stages back then. It might be a little bit different today, I'm not sure. So I had the mastectomy, thank God. Again, my mother, I swear, don't be afraid, Karen. Don't be afraid. Go ahead and have the damn thing cut off. My husband, God love him, and I've talked about him in my other videos, boy, he was supportive. He said, Karen, I just want you to be around. If you want to cut off the breast, cut off the breast. And that's exactly what I did. So that was that. In April 2009, I started my chemotherapy. They did at the time what was called dose-dense chemo, which means I had chemo every other week. So as soon as I felt a little bit better from the last round, I'd have to go and have another round. The first round consisted of adriamycin and Cytoxan, which is called the red devil. That's when you lose all your hair and you feel like a truck hit you. The second round was Taxol, which made my bones ache unbelievably. I was in such pain. Then that ended around the middle or end of July, I'm not sure, and they gave me about a month's rest, and then they went right into the radiation. So I had radiation therapy, 28 treatments, Monday through Friday, through August into September. And mind you, I was still working a full-time job at Moffitt. I missed a day after, usually I missed one day after my chemo. But during radiation, I went to work every day, and boy, that radiation makes you exhausted. But I'd put on my kerchief, whatever color scrubs I had on that day, I matched it with my kerchief. And I put it on, and I went into that women's breast clinic, and I did my MRIs on these breast cancer patients. And I guess I provided them a lot of support and hope just because I was working and they could see what I was going through. And I would always tell them, look, if I can do it, you can do it. Come on now, let's go. I was like a cheerleader. I was put in this job for such a reason. It was divine intervention. I don't know any other way to describe it. Well, anyway, unfortunately, the cancer drugs that they gave me, I don't know whether it was the Red Devil or the other stuff, I got severe neuropathy in my feet. See, it affects the extremities. It's such a toxic, cocktail. It affects your nerve endings. And the nerve endings in my feet were so tender. I eventually wasn't really able to stand up that long or to walk that far. And I had to go out on disability. I couldn't work anymore. Couldn't do that MRI job that I loved. But I had to leave. And so I left. They had a massive layoff at the time at Moffitt, and I was a relatively new employee, so I was getting laid off anyway, and I kind of knew that. So after I left, I applied for disability because there was no other job in this world that I could do other than that. And I've been on disability from that job ever since. And it wasn't the cancer that they put me on the disability for, it was the neuropathy. You see, if you're in a position of 15 years or more, I guess this is one of the rules, and you cannot do that same position anymore, you can qualify for disability. I can still make some money doing odd jobs, and I have. I tried to sell real estate for a while. I was a receptionist at an assisted living home. But no job is ever going to compare to the one that I had at Moffitt Cancer Center. And I'm so grateful to them. I'm so grateful. It was a series of coincidences and divine intervention that got me my diagnosis. Think about it. If I was not a breast MRI specialist at a major cancer institution, would I have gotten an MRI and discovered that I have cancer? At stage 3 even? No, because my mammogram was clean 2 months before. I did not have a lump. I had no symptoms. But my mother said to me, Karen, do it. Don't be afraid. I'm here with you. So every night, I say goodnight to God and my mother. I thank them both that I'm still here 10 years later. Because without their help, I wouldn't be. And I believe that. You don't have to believe that. But I believe that 10 years later, I decided to have vertical gastric sleeve surgery. Because, and I explain this in my other videos, if I'm at a healthy, normal weight, my chances of remission stay very positive. If I stay heavy, fat, become diabetic, my cancer coming back, the chances increase a lot. So that's my story, folks. Believe it or not, I'm so lucky I'm here. And I will probably come up with another video after my 3 weeks are over and I begin my 4th week. I'll tell you all the trials and tribulations of week 3 VSG in a few days. Sorry if I went off topic for a little bit. I just wanted to tell you my background story. Take care, YouTubers. I love you all. Bye-bye.